Good morning. I had a choice of gavels this morning.
What, for hitting the Vice Chairman?
Did you hear what he just said? Yes. I went for the largest one, look. Yeah. Right, good morning everybody and welcome to our meeting. As you all know, my name is Sheila Gurney and I'm the chairman of the Adult Social Care and Public Health Select Committee, and I'm chairing this meeting. Before we continue, I'll go over some general housekeeping, if I may. So this meeting is being held in person at County Hall and is also being streamed live on County Council's YouTube channel. The recording will also be available to view afterwards. A fire alarm test is not expected during the meeting. If the alarms sound, we must evacuate County Hall. In the event of an emergency, please make your way to the nearest exit and meet in the muster point located on the main car park. So that's the general housekeeping. Are we live, please? Yes, thank you. So we moved formally now to the agenda. And if you'd like to turn yourselves to page 1, there's the membership there, and I will take apologies and substitutions. Thank you.
We've received apologies today from Councillor Carl Smith, and Councillor Michael Chenery is substituting, from Councillor Brenda Jones with Councillor Chrissy Rumsby substituting, from Councillor Alison Birmingham with Councillor Mike Smith-Clare substituting, and from Councillor Ian Mackey.
And no substitute for Ian? No? Okay. Thank you. We move on to item 2, ladies and gentlemen, and it is to agree the minutes, please, of the previous meeting, which I'm very grateful that my Vice Chairman chaired that meeting of, so thank you, Councillor Clancy, for that. So can I turn to page 4, please? And we are looking at these now just for the benefit of correctiveness. Thank you. Page 5. Page 6, 7, 8, and page 9. So could I have a proposer that these are signed as a true and accurate record? That's Councillor Bambridge, thank you. And a seconder, please. Thank you. Right, I'll sign those at the end of the meeting. Thank you. Item 3 is for members to declare any interests, please. Are there any this morning? I'm just having a look around the room. No, I can't see any. So they're recorded as none, thank you. So item 4 is updates from the chairman and cabinet members. And I'm just having a look here for my briefing note, if I may. I don't have any updates myself as the chairman. I don't see any cabinet members here this morning, apart from Councillor Jameson, but you're speaking on one of the items later, aren't you? So public question time is item 5, and we don't have any public questions for this morning's meeting. And item 6, local member issues, member questions. I have not received any notification of any member questions that people wish to raise. So we'll move on then to the formal part of the agenda, which is on page 10, and we will have a look at the strategic and financial planning 26-27. There's a report there from the Director of Strategic Finance, and I understand that Councillor Jameson is going to introduce this paper. Thank you. Thank you.
Thank you. Yes, I will, Chair. Thank you very much. Nice to see you, and nice to see you all, councillors. Back in February, we committed Norfolk County Council to show that it is possible to deliver high-quality services whilst maintaining sound financial management. And that is what we're doing through careful planning, through prudent investment, and a relentless focus on efficiency. Our strategic aim is to protect essential frontline services and continue to drive better outcomes for residents. And despite a backdrop of rising demand and economic uncertainty, we have so far achieved significant savings through smarter commissioning, through shared procurement, through digital transformation and service redesign. And these measures are not about cuts. They're about value. They're about ensuring that every pound that we spend delivers maximum possible benefit. This disciplined approach is enabling us to absorb the inflationary pressures and growing demand while keeping the Council on a sustainable financial footing. However, as the report makes very clear, much is still needed in order to deliver a robust budget. And therefore, it is vital to recognise why the financial pressures on local government, and particularly on Norfolk, remain so acute. Adult social care and children's services now account for over 2/3 of the Council's total spend. Costs in these areas continue to rise sharply, driven by demographic change, by the complexity of need, and a sustained impact of inflation upon care markets. In adult social care, of course, they have previously tackled this via their Connecting Communities programme. Initiated in 2021, it has delivered over 35 million net in savings. It was a programme which cost us 7 million to put in place, but the net figure is 35 million, and we're anticipating ongoing savings in the region of 23 million pounds. This is a significant saving, and of course it underlines the basic concept that we're undertaking here. Transformation, it's a very glib word, transformation, but you will see from the next item, I think it'll be a really interesting item, which is going to be delivered by Ian Wake, our DAS, in terms of his strategic vision to carry on for further savings, because it's an ongoing battle that one needs to do to continue to look at best practices and drive efficiencies via transformation. And I think it's an important point to notice. And I'd just draw your attention perhaps to, let's see what the page is in this paper. It's page... page 31. Page 31, just table 4 there, just shows you what our savings requirement is. And of course, we've always talked in terms of new savings target of around £41.5 million, but it's not actually. The total savings that we need to deliver for the 26-27 financial year is over £62 million. But you can see there that £21 million has been baked in, as they say, rather dreadful word, but has been baked into the medium-term financial programme. And that is not by chance. Over the last 4 years, through finance, we have been helping the key spending departments of children's and of adults to seek ways in which they can transform their departments over the medium term. It's not something you can do in just 1 year. And very often you need to spend a bit in order to develop those savings. And this is a very key part, because in increasingly difficult financial times, local authorities are forced back to their statutory duties. Now, prevention doesn't necessarily, or very often, be covered by statutory. But it is absolutely vital if one is going to keep the costs down over the medium term. And so it's this medium term philosophy that we are increasingly adopting here in Norfolk County Council, which is helping us to deliver those services. Table 2 on page 30 highlights the significant budget pressures that this council is having to absorb this current year, 25-26. They're in part driven by higher levels of inflation, part driven by the national living wage, as well as the impact on to employers' national insurance contribution. These are all well known to you. But the 26-27 budget provides growth as a result of more, I would say, normal historic levels. But the trend in growth is a significant challenge without the requirement for increased savings targets and or possibly the provision of additional funding. But the news or the rumours being floated prior to the budget do not look particularly pleasant for rural counties on that score. So at the same time, remember that the government's funding assumptions for local government effectively presume that Norfolk will increase council tax by the full 4.99%, including the 2% adults social care precept. That expectation is built directly into national forecasts of local authority spending power. So when the government says that we have a 1.1% real terms increase in our spending power, that presupposes that local authorities will put up council tax by the maximum available. Of course, the most recent balloons, amongst many being floated pre-budget, is that this cap could be lifted or taken off entirely. But there seems to be an awful lot of things floated and then removed again. But the key point is that the burden of maintaining essential services is continually being shifted down to local government and onto local taxpayers. Nationally, council tax accounted for 55% of the increase in local authority core spending power in 25-26. It was 46% or something in 24-25. And I think that pattern will only continue. There have been many recent reports highlighting the pressures faced by local authorities across the country, including Kent, for example, which have underlined the stark reality, and that is that many councils are at breaking point, and easy savings that were floated a year or so ago have yet to be made because they don't exist. And I think that it is likely that most local authorities will be needing to put up council tax considerably again this year. But in Norfolk, though, our approach has been different. It's prudent, long-term planning, an unwavering commitment to value for money, so we've avoided the kind of emergency measures that we've now seen elsewhere. We have not had to resort to short-term cuts to balance the books, but instead we have protected service levels, we've supported vulnerable people, we continue to invest in Norfolk's future, all while delivering a balanced budget and a clear path towards continued financial sustainability. And if you look at Table 6, it's on page 33 of the amended budget paper, and that illustrates it clearly. The savings that we are proposing are not reductions in services. They are efficiencies arising from the ongoing transformation programme. They'd include the digital and automation programmes, back office functions, smarter procurement in adult social care, transport contracts, delivering better value there without compromising quality. Service integration and early intervention in children's services has helped too. That's helping families sooner. And I think there's a core value that is changing here. When I started this job in Norfolk County Council on the cabinet, I don't think anyone worked for Norfolk County Council, actually. They worked for adult social care, or they worked for children's services, or they worked for highways. But now I think that there is a much more holistic approach amongst all, not just senior management, to the idea that we are Norfolk County Council. We stand and fall as Norfolk County Council, and we look to each other's budgets to a much greater extent to see where the savings can be made. And so, I think in spite of, this is just hallmarks of responsible financial strategic management. But in spite of, the significant proposals that you'll see have already been identified, we continue to face a substantial gap. That will need to be addressed in order to enable a balanced budget to be proposed to full council for 26-27. Currently, our forecasts suggest a gap of 25 million, and you can see that that's set out in paragraph 5.6 on page 38. That said, our task has been made considerably more difficult by ongoing national uncertainty. The government has yet to publish the outcomes of the SEND review or to clarify the implications of the long-promised fair funding review, although that is due very soon, 28th, I believe. But these omissions make it very difficult to plan with confidence for the years ahead. And equally, the late timing of the autumn budget means that key details of local government settlement will not really be available till mid-December at best. The MHCLG has just announced that they will make a policy statement later today, we think. And that might give us an indication of government funding levels, but we really will not know until the local government funding settlement. And there is no indication, particularly given the lateness of the budget, that this is going to happen very much before Easter, despite bland assurance to the contrary earlier on. But these late announcements undermine the stability that councils need to manage resources effectively and deliver services with confidence. So I'll finish by saying, though, that the government's anticipated long-term settlement may help to address that in the future, and we'll await details for that later in the year. Thank you, Chair.
Thank you very much. Are there any questions now, please? Thank you. I've got Brian, Mike, thank you. In that order, Brian, thank you.
Thank you, Chairman. Well, I think that all of us are aware of the continuing financial pressures that the Council faces, and that's not going to change anytime soon. As Councillor Jameson has said, next year, 2026-27, we have a budget deficit of around 41 million, and that's 62.5 if one considers the total savings required, and then over a 4-year period it's near 170 million. So we've got huge challenges ahead of us. I think that there is a general consensus that we all wish to see reform of adult social care funding. It's absolutely essential that that happens, whatever that might entail. But I think the fear that that's not something that's going to be coming anytime soon. We have the Casey review in progress at the moment, but I think any change is probably a long way off. And as Councillor Jameson has said, there are a lot of uncertainties at the moment in terms of what's going to happen in the budget, in terms of what our financial settlement is going to be for next year. And of course, we've got the difficult decisions that we're going to have to make as a council in terms of the council tax rates and how much we're going to levy on the council taxpayers of Norfolk. Those are not going to be easy decisions. Obviously, instinctively, we want to try and sort of ensure that the burden on those council taxpayers is kept as low as possible. I think Norfolk County Council, essentially, we are going to have to try and do more with less. We have to try and be smarter and more efficient. There is no silver bullet, and I think that is why transformation is so important. We'll come on to that later. I won't sort of go into detail about that now. But, you know, I think as things continue to change, we have to adapt our approach to meet modern needs. Suffice to say, when we discuss the transformation paper in a few minutes, it's got to be made to work, not just from the Council's financial perspective, but in terms of providing service users with the best quality care that we can possibly provide. My last point would really be about the uncertainty about the future shape of local government in Norfolk, what comes next, what it will mean for the service and those people that rely on it. We will discuss that obviously, but it's a transformation. Is it going to be essentially a transformation for the next 2 to 3 years? Is there a sort of consensus across the adult social care environment that the approach that we will be discussing in a few minutes is the way forward? So I think there's some very, very important questions that we will need to consider with regard to that. But I'll leave it like that for now. Thank you, Chair.
Thank you. Who'd like to answer that particularly? The last question,
yeah.
I think, is really salient, actually.
I think it is. I might just have a quick comment on that,
Yes,
if I may,
thank you.
Chair, and then
Yeah.
pass over to the DAS on
Yes,
on
please.
that.
Thank you.
And just take Brian's earlier point really on the fact that there is still a gap and so on. I mean, the £25 million gap that I quoted earlier on is, of course, after Budget Challenge 2. I've instituted we're going to do Budget Challenge 3, but I instituted a Budget Challenge 2.5 this year, which was specifically for adult social care, children's services, and highways. You know, so that 25 million has come down to around 18 million now, but we're now looking that there are only 3 ways in which we can fill that. That could be better than expected government assistance. That could be higher council tax, and that will be continued savings. The point I would want to make before passing over to Ian on local government reorganisation is that as the Corporate Select Committee heard yesterday, the changes are formidable, whether it is 1 unitary, 2 or 3. If it is 2 or 3 unitaries, the disaggregation, not just the costs, but there's only 1 human to do every job. So if they're having to do transformation and having to do local government reorganisation at the same time, it's the same people. It is going to mean, in my opinion, that those transformation initiatives that are so fundamental to our and indeed most local governments who've got any sense, that it'll be simply impossible. People will have to pivot towards reorganisation, disaggregation, splitting everything up, and that 3 to 5 years. So I think the sort of savings that you're going to see through the sort of strategies which Ian will be talking about in the next item are going to be very hard to come by under those circumstances. I don't know, but Ian, perhaps you'd like to talk about the strategy itself.
Thank you, Ian. Thank you. Mr. Wake.
Thank you, Chairman. As you've alluded to, I think absolutely correctly, but my first observation is there's insufficient money within the system, and we will try and continue to reform, continue to transform, continue to become more efficient. But at some point, if you look at the MTFS, I think for all councils in terms of adult social care, the cost pressures that Councillor Jameson has rightly set out in terms of the demographic challenge, complexity and care inflation will bring us to a point where the system is stretched to the point it breaks. Over our own MTFS, we have in effect got to take out a third of the operating budget of adult social care over 4 years. That is a huge challenge. Is that deliverable? I don't know. And the case review, as again you've rightly identified, in some senses has kicked the can down the road. So we will be waiting until 28, 29 to get the full outcome from that. So at some point, something has got to be done in terms of the funding side of adult social services. However, and to be more positive and optimistic, and if one's a DAS, one has to be an optimist. My observation, and we'll come on to this a bit more, I think, in the next item, is that the way that we have delivered public services historically through a new public management approach, a threshold approach, a approach that says, are you eligible for a one-size-fits-all service? And if you're not, go away and come back when you're ill enough. Well, the problem with that, telling people to go away and come back when they're ill enough, is that that's exactly what they do. They come back often quite rapidly, much iller, and end up costing more. And the way the system is fragmented, my observation is that all of the really complex problems, the problems that are subject to complex systems, whether that is homelessness, whether that is addictions, whether that is obesity, whether that is the sustainability of the health service or the adult social care service, all of those problems are getting worse. And I think we recognise that the public sector system is fundamentally broken, and we've got to do things in a different way. And I hope, I more than hope, I believe, I strongly believe, because I've done it before and I've seen this working, that we can transform how we actually deliver public services and redesign them to make them more human, to make them less box ticking, to intervene earlier, and that delivers both better outcomes and saves money. And we need to go at that. We will go at that really strongly. I would go at that, to be honest, if I had all the money in the world, because it's the right thing to do. And I know it delivers better outcomes. But fortuitously, it does save money. And that's got to be a better approach than cutting things and restricting things, as Councillor Jameson has quite rightly set out.
Thank you. A question from Mike Smith. Claire, thank you. Please.
Sheila, Brian has already eloquently asked my question, which
Okay.
I will forgive him for, and I do appreciate the answer that has answered my question.
That's great. Thank you. Well, I'll move on to my Vice Chairman, Stuart Clancy. Thank you.
Thank you, Chairman, and thank you, Councillor Jameson. It's a big conundrum. The reality of it is, nationally, no government has grasped the adult social care nettle, and it's unlikely to be grasped in the term probably of this existing Parliament. And it's a problem, massive problem, because the demographics of specifically Norfolk, there's the older population, people are getting older, and there is a need for us to act locally. We have to act locally because we're not going to get the vast amount of support nationally from consecutive governments. This is not a political issue. This is an issue of good management and good finance. And I think where Councillor Jameson is now pointing the direction of where we need to be is absolutely where we need to be. It's really refreshing to hear the Director, Mr Wake, say that, you know, we need new practices, better practices, practices which the bottom line is delivers more for less. Good management practices, lean approach, transformation, badge it as you like, but the reality of it is we have to do more for less. And I think this is where we're headed with this budget. It's tough decisions, but the reality of it is, again, we have to be, interventions need to be coordinated, they need to be efficient, and they need to be effective. And I think, you know, we're making good progress in this area, and I really genuinely believe this. If I didn't believe it, I'd say so. But I really believe there is the need for this progress, because we just can't carry on business as usual. Business as usual, I'm sorry, I'm going to make a comment. Business as usual, government nationally or locally, does not work. It's not working for people. And I think somebody said, I think it's Mr Wake said, there's a recognition that systems are broken. Government is broken. This is not politics. This is not Labour, Liberal, Tory. It's broken. Public services in many respects are broken. And I think we have to address these issues locally. We have to put things on a sound financial footing. And I believe what we've got looking at here will do that. I think somebody mentioned, and I think as Councillor Jameson mentioned, if we try to disaggregate this through LGR, this is not and cannot and will not happen. This is going to take 10 years at least to do. In the meantime, the worry I would have is the recipient of the service potentially loses out. Our customers lose out because we're very, very busy dealing with the LGR. We're very, very busy trying to integrate transformation, improvements in service. At the same time, we're actually splitting the service. So it makes no sense. We're not perfect. I know we're not perfect. And, you know, and I think everybody would acknowledge we're not perfect. But we have to make these improvements. But we also have to actually be highly focused on the end user. And I believe these new systems, these new practices actually do this. And I wouldn't be saying this if I didn't actually believe it, because, again, I'll be in trouble, I know. But I'm not a highly political person. This is not about politics. This is about the service to the clients of this service. And I have confidence that the department is now genuinely getting to grips with this. Thank you, Chairman.
Thank you. Chrissy Rumsby, thank you.
Ryan said a lot of what I was going to say as well, so
So, all right, are you happy to?
I'm happy to listen to further, yeah.
Yeah, lovely, thank you. So I move on to Sharon Rundle, thank you.
It's not really a question, it's really a comment. What I want to bring up is we'd be in a worse situation if we didn't have our unpaid carers and our young carers in our society. If all of them suddenly gave up what they do, we'd be in a much worse situation. So I want to praise those people. I know it, because obviously it has not been brought up, but they save us millions of pounds, and that's the comment.
I think it goes a bit broader than that. I'd like to just praise every carer. I'm quite a carer myself now with my 95-year-old mother, so Stuart. We're all experiencing the system, and we're all caring for, in particular, my mother, who's becoming more demanding on me, especially at 3 a.m, which isn't very helpful sometimes. But I'd like to just praise every carer, actually. It's just not the young, it's everybody. I know young carers, it's far more difficult, and I've worked with young carers in the past. When I was the chairman of the council, it was one of my themes for the year, and I took a group of young carers out for an afternoon and also fundraised for a group of carers in Windham. So, yeah, it's more difficult, I think, for them and with their education and the demands on that and everything. But I praise everybody. Thank you. Right, Yes, everybody, yes. Sharon was my last speaker on this, unless anybody else wishes to say anything. My list is now exhausted. So I'm just last orders for questions, I think, on this particular topic. Yes, thank you. Leslie, thank you.
First part of the document, aren't we? I might have a question.
Yes, we'll move on then. Yeah. Andrew, did you want to come back now?
No, thank you very much
please?
indeed. I'm definitely going to stay for the next item there because it's highly relevant.
Right, so do we want to move on now to the next item on the agenda, please? Thank you. Before we do that, I'm just being reminded, and I'm slipping here in my role, that there are a number of recommendations for this item. So if I just change my glasses. Thank you for that. Yeah, now I've got them here somewhere. The recommendations in relation to this are on page 10. So there's consideration of the latest budget and medium-term financial position as reported to Cabinet October 25, which is in Appendix 1. Noting in particular that emerging risks and uncertainties within the Council's planning position. 2, to consider and comment on the savings proposals. I think we've covered that one. and to note the budget gap. I think we've covered that one. So can we all agree then with the recommendations on page 10, please? Thank you. And can I have a seconder, please? Thank you. Councillor Banbridge, can you all show by indication, please? Raise your hands if you're in favour. Thank you. That's carried. Thank you very much. Thank you. So we'll move on then to the next item, which is the Adult Social Services Strategic Priorities Transformation, a report from the Director of Adult Services. I think Mr. Nicholas Clinch is going to present on that. Oh no, Mr. Wake, thank you.
If I start, and then I'll hand over to
yes, okay,
to
then.
Mr. Clinch.
Thank you.
So thank you, Madam Chairwoman. It's a pleasure to be here at this committee to present what I hope you will agree is a comprehensive and really ambitious programme of transformation for adult services. It's based on I've been here just over a year. It's gone really quickly. But it's been based on a diagnostic that they undertook during the first 3 or so months after arrival to really identify what was working well within the department, but where the opportunities were for improvement. I'd say, first off, there was a huge amount to celebrate. We had and we have huge leadership talent. We have really committed practitioners. Our work on AI and digital is amongst the most innovative I've seen in the country. We have really strong analytics capability and capacity, a strong public health function, and a really strong capital housing programme. But there were also a series of opportunities for improvement, and I made a range of observations. My first observation is that the Norfolk system is what I would call over-demanded. So there's a much greater proportion of our population that knocks on our adult social care front door asking for a service compared to other comparator local authorities. And what I took from that is that actually perhaps we're less good than some of our peers at preventing, at delaying, at deflecting some of that demand from our front door. And then secondly, when that demand knocks, we had built an extraordinarily effective and efficient process that actually did the wrong thing, that immediately jumped to assess people's needs against a series of deficits that we had predetermined, decided whether they met that threshold, that eligible threshold for care, and then prescribed care if they did as our first response. So the conversation we were having is how much of what we have predetermined we do in advance are you eligible for? My third observation was that the care management model was operating largely in a silo and in a system that is fragmented, and it speaks to what Councillor Clancy was just saying about public services being broken. So we know that there are a cohort of residents that we support, a large cohort with complexity. What do I mean by that? People with overlapping needs, typically physical and mental health needs, care needs, addiction needs, housing needs, and to some extent for some people debt needs as well. And yet these issues are traditionally dealt with by different teams in different organisations at different places, different times with different eligibility criteria. And so those residents found it really hard to get a solution that actually managed all of their needs. And they ended up bouncing around the system, being referred from pillar to post, often falling through the cracks, not getting their needs met, but consuming a huge amount of public sector services. And so we needed to find a way to bring professionals from different teams, different organisations together to form relationships with each other and with residents such that they could produce with the residents a single solution that addressed all of their needs in one place and at one time. And then finally, I identified multiple needs, multiple opportunities in commissioning. So we have an over-reliance in Norfolk on residential care, particularly in working age adults, so people with learning disabilities and mental health problems. There was an opportunity to develop new commissioning strategy, new models of care that are more effective, particularly around home care and day care and accommodation-based care, supported living. Need to develop the market to do that, and some opportunities about how we actually procure care. So having a single dedicated team of officers that are working with our care providers, rather than what was happening historically, which was actually care providers were trying to deal with multiple different social workers. So I set out from that diagnostic 6 strategic priorities, which are shown on figure 1 at 1.4. And these deliver better outcomes, in my view, at a reduced cost by 4 key mechanisms. Firstly, by preventing and delaying that demand in the first place, by working with our really rich third sector, our voluntary sector partners, on asset-based community development approaches. I believe that the public sector has usurped at times on some of that sector, and actually the third sector is often better at helping and empowering communities to help themselves than statutory services are. But also through population health management approaches, by intervening earlier, identifying cohorts of residents that are at risk. So Mr Clinch has developed and led a really innovative Falls AI programme. We wanted to expand that, and we want to take the same approach with cardiovascular disease. Secondly, where demand does occur, a shift from a care management approach, that conversation about how much of what we've predetermined we do are you eligible for, to one that starts with a very, very different conversation. A conversation that goes something like this. What really matters to you? What does a good life look like for you? What can you do for yourself? What can you do with a little bit of help from your family and your friends and your community to meet your goals? How can we connect you with that help? And then what's left? And what's left is the statutory element, but that comes last in the conversation rather than first. And what results is something that is far more holistic, far more personalised, far more bespoke, and plays in the strengths and the assets in the third sector and people's local communities. Thirdly, integration, making it easier for professionals to collaborate at neighbourhood level through integrated neighbourhood teams, such that for those residents with complexity that I've just described, all of their needs, as I say, can be met at one place and one time. We prevent failure demand, we prevent people bouncing around the system, consuming resources, falling through the cracks, never getting their needs met. And then finally, as I said, improving commissioning, leveraging our huge purchasing power as Norfolk County Council, commissioning better models of care, home care, day care, supported living, moving from spot to framework, developing our capital programme. I also introduced to the department the concept of human learning systems. I've deployed this elsewhere to great effect. It's set out in detail in section 3 of your report, but it's a set of principles and values that moves us away from that box ticking, that broken model of public sector services, of new public management. That it's an approach that recognises and embraces complexity. What do I mean again by that? That the outcomes are made in residents' lives through the interaction of many different variables, many different factors coming together, rather than through single programs or services. And because that system is complex, it's constantly changing. And so the best way to manage that system is through continuous learning, experimentation, adaptation. It recognises that we ought to create healthier systems, because healthier systems deliver better outcomes. What's a healthier system? It's one where power is shared between all of these system actors, rather than just sitting with someone like me trying to control it in a top-down way. Because how on earth can one person ever know and understand all of the variables to control it in a top-down way? A healthier system is one where leadership is distributed, where everyone has a voice, where collaboration between professionals is easy. And then finally, on the human element, a real focus on relational practice. human public service. Form a relationship with each and every resident that we seek to serve. Find out what really matters to them and let the solutions drop out of that relationship. And if you think about it, that's a fundamental power shift, isn't it? It's one where we approach that interaction where us as the professional deciding, diagnosing and telling the person what's wrong with them and what they can have, to one that actually recognises that it's the resident themselves that is the expert in their own lives. And they have as much to bring to that conversation and that solution as us as professionals. So I think it's a very humble way to try and approach public service. Human learning systems is described in more detail in section 3. I may be biased, but I do believe this is truly transformational by changing the way we deliver public service to better understand and respond to the need, to intervene earlier, to prevent problems. We can deliver better outcomes and we can save money. We've grouped the elements of the programme we've built into 6 portfolios, and Mr Clinch is now going to take you through some of that detail. Thank you.
Thank you.
Lovely, thank you, Chair, and also thank you, committee members. So I think Ian has articulated really powerfully the impact that we want for people and actually for our staff. What the paper takes you through is essentially the key building blocks that will provide the basis for that transformation and make sure that we've got essentially the right conditions to be able to deliver it. So I just wanted to quickly start with, I guess, the way we work being really, really important. And part of what we've spent the last few months doing is working directly with our teams, both our leaders, but also our public-facing teams who work on the ground with residents every day to build the mission and values defined within the paper. Alongside that, I think the human learning systems that Ian has described, that way of working, is a fundamentally different approach in terms of practically how our teams will work. So as a really good example, to give you a bit of flavour about what that will mean, is that insight that we collect every day, whether that be from data or stories from residents, human learning systems mean that we will reflect on that learning at a team level continuously, but also reflect on it at all levels of our governance within the department. So the idea is that we're building learning, listening to residents, to our staff, into how we work, and not just evaluations perhaps on an annual or set time scale. So that way of working, without doing this effectively, that is a key building block to how we're going to deliver our transformation. So Ian has rightly laid out the priorities that you'll find in section 1.4 of the paper. What we've then put together is a set of what maybe clunkily we've called 6 portfolios of work. Essentially, those are the way that we've grouped those pieces of work together to enable our teams to be able to deliver them with wider partners within our integrated care system. Those 6 portfolios that you'll find detailed within the annex of the paper, we've gone into further detail about what they cover. So that's communities and neighbourhoods, so that asset-based way of working that Ian has described, alongside how we work at a community level, population health management, our model of social work practice, intermediate care, support around complex community support and commissioning. So as an example of that, because we don't have time to go through all of those in detail, a good example is the community and neighbourhoods area of work. So one of the specific changes that we want to bring about is around implementing a local area coordinator model, which you'll find details of that in the annex. So essentially what that will mean is roles based within local communities who proactively meet, engage, support, work with residents every day in their wider families to build that trust and connection with them, build with them together that plan that recognises their own capabilities, what they inherently have themselves and in their wider community, and then supports them as well to access practical resources to help them in their life. So that's one very practical thing, which is the thing that we will do. But really importantly, I think also highlights the way in which we do that as teams and with our wider partners. So part of the way that we will deliver this transformation is by having something called cross-functional teams. So going to that point around, we can't do this by ourselves as social care. This is around how we deliver it as a whole system. Those teams of individuals that will be delivering this transformation are made up from leaders within our own department, both social care, but also really importantly, public health. Colleagues from within the wider council, including really building our relationship very strongly with children's services, but then also our public-facing teams, wider partners in the integrated care system, and I think that's where our partnership that we've discussed in iterations of this committee before with Norfolk Community Healthcare is absolutely vital, and then also the voice of residents being continuously part of that approach. And that will be the approach that we take for all parts of our transformation, not just local area coordinators, but all of it. The benefits of taking this approach, so the transformation across all of our areas of adult social services has really significant benefits for people and for our staff. But also we'll have that financial benefit as well. And that's, we're using business cases and ways of working to be able to model and detail that. There is some really strong existing evidence of how we've done that already within Norfolk. So Ian rightly highlighted our proactive intervention approach, where we've been using AI to support people at risk of falling. That's a really good example of some of this relational way of working. It has a strong evidence base for the impact it has on people, but also on demand for care. But we also know nationally there are other places such as Thurrock, where Ian obviously has previously worked, but many others who have worked elements of these models and have really good evidence bases for the impact. One example of that, community-led support, so that different relational way of working with residents, are some excellent national examples of research studies that have provided us really solid evidence base for actually quite a short-term impact on the demand for formal care packages arising from that. So we really strongly believe that this transformation is grounded in improvements for people and for our teams, but also will deliver our tough financial position that we need to get to. So I'll just finish, I guess, that there's an obvious risk around timing for this for us, so we want to deliver this at really significant pace. There will be things that we don't get right along the way, but actually that human learning systems approach is all about learning and adapting to that really, really quickly. But there's also a really key opportunity, which is that our staff really want to work in this way, actually, and much of that training and basis for people that work in social care is very much in this kind of way of working. We want to really enable that for our teams. Also, our partners, Councillor Watkins mentioned it earlier, our partners also, I think, are really on a journey that is very similar to this and want to work with us. I think particularly in the NHS, but also much of our wider voluntary community and social enterprise sector want to work in this way. And so I think we have a really willing and actually very keen set of partners that want to work with us, and we want to work with them so that we build on existing work and don't duplicate approaches. So the recommendations that we've made to the committee, obviously your views on the approach and the content of the paper, we're really keen to consider with the committee how you can engage with this approach, and particularly the test and learn approach, so that we will be continuously building this. It isn't we've defined all the answers now. And we have made a recommendation that we thought it might be helpful to come back to the committee on an hour scheduled basis to go into real deep dives on each of the 6 portfolio areas, so that you have time to help understand and develop those in detail, because they are all quite large and expansive. Thank you.
Thank you very much. I've got a couple of observations, if I may. On page 58, under 1.21, demand and cost, you talk about national demographic trends and local trends, including the impact of rurality. But I want you to talk about also, and it has been mentioned, but in the report maybe, about the impact of an ageing population in Norfolk, which we've had for quite a number of years now, mainly because lots of people do move up to Norfolk in later life because they like what Norfolk can offer in terms of the coastline location in particular. So I think we need to balance a bit more weight on that as well. And when do you sort of anticipate this kind of going live, so to speak? I know we're starting to do a lot of it already, but is there going to be a sort of time where we actually say this is it and this is what we are really doing? Please.
In terms of your first point, I entirely agree with you, and you've hit on 2 of the key challenges that I think Norfolk faces that other authorities don't face in terms of our demographics. And North Norfolk, I believe, as a population age structure, has the oldest population in the country. Yes, and secondly, it is incredibly difficult to provide services in rural areas compared to urban areas for the obvious reasons of transport and connectivity, but also workforce itself and trying to get that workforce out. What I would say is this kind of hyper-local neighbourhood approach and asset-based community development is really, really important for older people. And I've seen the power of it elsewhere where we've done it. So there's a huge, I think particularly in rural areas, there's a real risk of isolation, isn't there? And there are so many of our older people who feel lonely. And we know, and there's an increasing evidence base on loneliness, about how health damaging that is, and how people deteriorate when they're lonely. I remember reading one study that suggested that loneliness, prolonged loneliness, is as dangerous as smoking 15 cigarettes a day. And so building an asset-based community development approach with the voluntary sector at a hyper-local level, such that you can address some of those things, I think can really improve people's lives, and particularly that demographic, and in turn help them deteriorate, help prevent them from deteriorating. So I think it's a very effective approach.
Because we have lots of hubs for children's services around Norfolk now. In fact, I've got one of them set up, which I helped in Helsden, although not particularly rural, more urban. But are there any plans for sort of adult social care, public health hubs across Norfolk, which can kind of replicate the work that children's services is doing with the younger population, which we could be doing with the older population?
Yes, absolutely. There's an opportunity to see what we could potentially provide from the children's hubs as well. But with us, in terms of those community assets and using those spaces as hubs where we get into real next year, but we are phasing this. So not every area is going to get everything in one go. We just haven't got the bandwidth to do this, but we are going as quickly as possible to try and roll this out, because it's the right thing to do, and we need it in the context of the financial situation.
Thank you. I would say that our libraries are doing a lot more, and in fact I know from my own local library, working with dementia groups and all sorts of things, so and I do go down and things, so and I do go down and meet with them, and I'm sure other councillors do as well, and they attend theirs. So there is a wonderful facility already that can be utilised even more, and I agree with you there. Thank you. Mike Smith, Claire, thank you.
Thank you, Sheila. Firstly, an apology, and it is remiss of me. I do run my own voluntary community sector engagement, and that highlighted just in case, because I do work with vulnerable adults and support them. Firstly, I completely support the vision. I think it's an excellent vision. It's not just excellent, it's innovative, and I think for those of us that are in the sector, we know that it will work in terms of its process, and it's much appreciated. I do have a concern though, and that's with regards to the communities and neighbourhoods element. And the concern is the reliance on the community sector, you know, the volunteers, the groups, the hubs that are there. We know it's a shifting sands world out there, and we know that due to lacks of funding, changes in perception and those funding streams, what looks like it's there at the moment might not be there in a year's time. And unfortunately, due to the complexities and the restrictions of funding, so much that comes to those community groups has a 12-month life. And the fear of us relying on that is palpable. And the concerns that that vision that we know is excellent cannot then be met. A second point, and that's in relation to that, is I sit on the Children's Services Committee, and I can see the impact that this reduction, this efficiency will have on families, of course then has an impact on children that live within sometimes those vulnerable families. What discussion, research has taken place between adult social services and children's services to look at ways in which this efficiency can be mitigated if there are any possible future negative impacts. Thank you.
Thank you. You raised two incredibly important points. On your first one, which was around the financial sustainability of the third sector, I entirely agree with you. And again, it's symptomatic of the state of public sector services in general and the fact that they are broken. My observation, having worked extensively with the third sector in the past, is often they don't even need very much money to deliver huge social value and amazing outcomes, that they're often far more efficient at delivering that than the public sector. I don't have a huge pot of additional funding that I can throw at the third sector, just to be realistic. We have what we have, but to be more optimistic, we are spending £305 million a year at the moment just on purchase of care budgets. That one-size-fits-all prescribed care is the first opportunity. If we can produce or co-produce with residents something that really meets their needs by having a different conversation, a what matters conversation to you, then that starts to release potentially some funding that can be reinvested in some of those third sector elements. And we are, within this programme, prioritising, as Nick has mentioned, a local area coordination programme. So local area coordinators are essentially community development workers, so they have a really good understanding of what's within their locality. They connect residents with that community resource, with those assets, but they work with the community to help develop more assets. And it's not always money as well. Sometimes it's about having a venue. So if we start to play in some of our estates, some of our infrastructure, and just some support from our local area coordinators, we can start to develop more community assets. And I've seen that done very effectively. I'm just wondering whether Mr. Chris Buttwright would like to comment. You're leading that element of the programme in terms of asset-based community development.
Thank you for the opportunity, and very much welcome the support that's coming forward in terms of taking an asset-based community development approach here in Norfolk. I've been here a little while and been working with children and adult services for some time, for perhaps about the last 20 years, to bring about an integrated working which focuses on the needs of our residents, informed by our residents in the places that they know best, and us becoming more local in how we go about that support. We do need that little bit of coordination, and that's where the local area coordinators very much can come in for us. But what we're looking to do is empower our communities, our residents, to say, actually, we know what we want, we know the support we're looking for, and we know when we best need it. And we know that's often earlier, and Ian has very much talked about that sense of us not prescribing care, but being informed by what people are telling us that they need and when they best need it. And if we're able to shift our support, our resources, not just of the council, but of the wider health and social care system and our colleagues in the voluntary sector, to say we can get alongside our residents to support them, that's that shift we're wishing to make. I'm really excited about this transformation programme, because it is building on the village halls. It's building on the support that you give residents as councillors, being a really key role in being able to do that. It's playing into our parish councils, informing our work at a very local level, something that we don't ignore, but perhaps we haven't highlighted those coffee mornings. We haven't been conscious about the support that is in our communities, that is driven by our communities, and that often a little bit of support, recognition can help us to deliver a different way of health and social care here in Norfolk. And I think that bit about the older population is important, isn't it, for us? Because I often think about Norfolk, and North Norfolk in particular, but Norfolk being at the forefront of the future of the country, and how we're going to have to look at how we support ourselves and how we work alongside one another, and those networks of support that are there. So it's very much looking at that exciting model of getting alongside people and working with people, and being able to address things from a public health perspective, that preventative approach is going to be so much better for us.
And in terms of your second question, which is the opportunity to link up with children, which is, again, a really great question, to reassure you, we actually had a really great joint directorate leadership team to directorate leadership team 3-hour meeting a few weeks ago with Sarah Tuff and her direct reports. There is huge synergy, and I'm ashamed to say we've developed these programs kind of in isolation, and when I heard what Children's were doing, there is huge synergy. They also have a relational approach. They are also trying to link in strengths and assets. They also have an approach of pulling professionals together around the child and the family in an integrated way. So I think there are absolutely further opportunities in which we can and will link up with them, and perhaps from some of their hubs we'll be able to expand and provide some adult services as well. But yeah, a really great point.
Thank you. Did you wish to come back?
Yeah, thank you, Sheila.
Thank you.
I appreciate that. I think they're, very, very detailed responses. And I do feel reassured. For someone that has seen this model work before, in terms of on our site, neighbourhoods that work in Great Yarmouth, incredibly effective model where there were community connectors that had links to the community groups, the support networks. It worked hugely effectively. Unfortunately, those of us that are old enough and a bit long in the tooth that have seen this over a 30-year period see sometimes a cyclical element of what is the appropriate strategy due to then a loss in funding or a change in direction, going into hiatus to then go back to reinvent it itself. We know what works across the sectors. I also have that concern. We know as well that the voluntary community sector does have huge impact, researchable, great impact on communities. It cannot afford to continue on great provision without appropriate funding. That is why so much goes under. Volunteers, a bit like we said with carers, are the backbone to the communities. If they are giving time and having huge impact on lives and improvements, they need the appropriate structural funding in order for that to continue. It can't just be a thanks, it has got to also have that understandable, continuous financial support. But thank you.
Thank you, Nick. You wanted to come back.
Yeah, thank you. Just briefly on that point. So I think also part of the way that we want to work that is incumbent also on our commissioners as well to change some of their practice. So, as social services, we do commission a number of voluntary sector organisations for different bits and pieces. And part of the transformation we want is to make sure that those, where we do have those agreements, that they're longer term, which is a point that you made earlier. Also, the way in which those commissioned arrangements are structured is about learning and developing that work together and moving a bit away from the kind of traditional commissioner-provider relationship, that it isn't just about regular reporting of long reams of key performance indicators, but actually about learning together and making improvements together. So what I wouldn't want is that the commissioning part of this transformation to just be seen about our commissioning relationship with the care market. It's also about our commissioning arrangements with all sectors that we have that kind of relationship with.
Thank you. I have Leslie Bambridge. Thank you.
Thank you very much, Chairman. This is an excellent future for us. I really like the holistic approach. It's completely necessary. And with the chart that you have on page 16 or 17, 16, I think, it says about housing needs, driving housing solutions, and there's a big requirement for that. Housing needs change on a regular basis, and they need to fit for the future. And the other, I'll go. I've written so many notes. I can't get where I'm going to. I do have concerns about how some people will be reached. It used to be people talked about the man on the Clapham omnibus and their opinions and views and whatever they were doing. But I always now refer to my 95-year-old neighbour. Having looked after my mother, who died when she was 92, I've got a little bit of experience. She's totally alone and has no contact with anybody. When she had an illness, the surgery didn't even ring her to see how she was afterwards. I just find that really awful. And she does reach out to me for some things. And I live in a small little cul-de-sac of about 40 houses. So I've made myself know everybody, but she doesn't. She doesn't know her neighbour. And so it is me that seems to be the only person that she contacts. So how will she fare in this? A local area coordinator, would they go and knock on the door? She's been subject, as I have, to somebody knocking on the door and saying, your roof needs fixing and I can do it for £800 cash now, sort of thing. And those things are all part of the whole problem, aren't they? So I recently was trying to help somebody and I rang Norfolk County Council for a contact. So I was signposted to the form and got halfway through the form and I was asked if I was a professional or if I was a family member, and I'm neither for this particular man. I'm a local councillor. So that needs to be changed straight away, doesn't it, for people to be able to approach Norfolk County Council. Mention's been made of going to libraries and other village halls and things, but some people can't actually get there. They can't walk there physically, and that, you know, the 95-year-olds. And so I really look forward to this because I think it's very, very important and has to happen. But I'm still dubious about how it will happen. And it says about embedding it across all levels. So is that, I presume that's within Norfolk County Council, but don't we need to do that with other district councils now for them to be involved, because there is this wide divide. I know we might be unitary, but it might be 3 unitaries, it might be 1, it might be none of them. And how are we going to do that? So somebody who has a housing issue may not, won't come into this necessarily unless somebody knocks on their door and says, "How are you?" But I think it's a wonderful document, and so perhaps somebody could tell me more about the local area coordinators.
Thank you. Again, some really great points. In terms of the housing issue, that you're absolutely right. There's a huge overlap between housing and care. In a former life, I used to be the executive director responsible for housing and adult social care, so I can absolutely get and understand the interface and the opportunity. It's obviously harder here at the moment because of the districts and boroughs, but to reassure you, we have got really good links with the districts and boroughs already. We are talking to all of them as part of this transformation programme. In fact, I'm going over to see Kate Blakemore in the West, and Kate's introducing a kind of relational approach to Kings Lynn and West Norfolk, where I know your division is. I'm doing that on Monday, and I'm really keen to work with them. In terms of how we identify people who may find it difficult to be identified, I guess, at neighbourhood level, at primary care network, geography level, so pretty local, a team of professionals that would include housing staff, would include community nursing, would include psychiatric nursing, would include psychology, would include addictions, would include our social workers, would include the third sector, would include people from the GP surgeries and the primary care network. Those those professionals, rather than just receiving referrals anonymously from each other, if we can, particularly if we can co-locate them, they form relationships. I used to talk about the power of informal relationships between professionals, because your 92-year-old is going to be, I would bet my house, in contact with one or more of those professionals. It's very unusual for someone at 92 not to be in contact with any services at all. But that will be one way where one professional recognises a need. If they are part of an integrated neighbourhood team, they can immediately pull in support around that person. The other way, if that person is genuinely not known to anyone, it is through a more proactive approach. So local area coordinators do go out, they do knock on doors. There's a brilliant project in Watton, actually, which did exactly that, and identified individuals, particularly with frailty, and just knocked on the door and said, is there anything we can do to help you? So you can do it in that proactive way. And then finally, you can do it in the way that Nick's done it through the Interactive Fools programme, and using big data, and people are on different systems, and from that you can identify cohorts of residents at risk and proactively contact them to see, to have that what matters to you conversation, and in what way that they can support. And then finally, the community-led support approach that is part of this, so the new social work operating model, is very much based on front doors being within the community. So rather than requiring someone to call up NCC and wait in a queue and get that standard response, we used to call them, in my last role, talking shops or community surgeries. And for example, we had one in the supermarket cafe in Morrison's, in the centre of Grays, so this is the main supermarket. And so anyone coming and doing their shopping, and there was a team of people there, team of professionals, they could just drop in and have a conversation. And we had picked up so many issues at a really early stage, and connected people with the right support, and prevented that person then ever getting to the formal front door, and then costing a lot of money. So I think it's a long answer, but through a variety of mechanisms, we will try and reach as many people as possible at the earliest point possible.
Thank you. You've alleviated some of my fears, because I'm going to get to 95, so I might need help then. Thank you.
Thank you. I have Brian Watkins next. Thank you.
Thank you. And just to say, I think there have been some really good sort of points raised in the discussion so far by other speakers. I too welcome the report before us this morning, and the direction of travel outlined. I think the plan is ambitious, transformational and forward-looking, which I think is very important. I note with interest the Director's comments about over-demand for our services compared with other local authorities. That's a bit of an eye-opener, but I think it's a very important, fresh perspective on the way that we provide and deliver our services across Norfolk. I appreciate that this transformation is a huge undertaking, and the amount of work and preparation that has been, and consultations that have been put to get us to this particular point. I think promoting independence, when it was, I think, introduced about 10 years ago now, something like that, that marked a departure from the traditional way that we provided services across Norfolk at that particular time. Not only has it, over the past 10 years, helped us to save money as a council, but it's represented a fundamental shift towards a more community-based approach, and ensuring that people have the opportunity to remain more independent. And I think that this is the next stage of that journey. And what we have before us in this paper, I think, highlights the Directorate's strengths, its workforce, its teams, its partners, whilst recognising the many challenges that it will be facing in terms of increased demand, in terms of cost, in terms of the sheer scale of the transformation before us. But essentially, I think with this human learning system, it's a fundamentally new approach, different approach, way of doing things. It's more people-centred. It's not a tick-box exercise, as you've already said. It's about establishing better, more meaningful relations at all levels, learning from one another, and at its heart, helping people to make the right choices about their lives. And we've already had a great discussion about the integrated neighbourhood schemes, as I've said, with some really good points being raised, and they are obviously going to be very, very important in making this strategy a success in the future and keeping people supported in their communities through different partners, through the ICS in particular. And we're talking about the crucial role of local coordinators, and my colleagues have made some good points about that. It's not all about saving money, although quite clearly that's very important. It's about making a real difference in people's lives, but we cannot underestimate the challenges in front of us, which have been well articulated by other speakers. Turning, if I may, to the section on population health management, yes, I think that could be and will be a real game changer if done in the right way. It's so important to be talking about a prevention approach aimed at the whole population, the wider population in general, and one that I think will help us to tackle the long-standing problems of health inequalities across the county. The Falls project has already achieved great things, a lot of success, and I think the cardiovascular initiative that we're talking about in the report follows on from that in terms of sort of identifying the people most at risk and helping us to avoid pressures further down the line. So it's an excellent idea. It's also been trialled in Thurrock, and it's been trialled presumably elsewhere in the country, and it's seen to work. But obviously here in Norfolk, proof of the pudding will be in the eating, as it always is. Briefly on commissioning, I think it's so important that we should have good relationships with our providers and that we get real value from those relationships, and that it's crucial that we have a local care market which is diverse, sustainable, and of course robust. We all know that there is much more that needs to be done in coming years to adequately meet the needs and concerns of more vulnerable sections, more vulnerable people in our community. We will need capital monies and lots of it to meet the growing demand, as stated in the report, promoting supported and independent living, housing with care, more intermediate care, targeted help for those living with learning difficulties and autism. I can, if I may, Chair, end with 3 questions. The first is, again, we're going back to the cardiovascular initiative. What confidence have you, and I hope it does work, we're all rooting for it to work, but that it will reach the people who need it most? And will this by necessity involve targeting poorer and more deprived areas, certainly initially, in order to achieve that? Related to that, how will you monitor that progress to ensure that the scheme is working properly, and how will it be measured? last question, really relating to the integrated neighbourhood teams, is just my slight concern about a level playing field here. How will you ensure that there is a level playing field in terms of access and quality of provision right across the county? Thank you.
Thank you.
Thank you again. Really, really great questions. In terms of PHM, no one loves big data more than me, and PHM is very much based on big data. Your first question was about confidence of reaching the people it needs to. It's actually quite straightforward for cardiovascular disease because we know who they are, because they are recorded on what are called GP QOF registers, Quality Outcomes Framework register. So each GP practice has to hold a register of patients that are diagnosed with various cardiovascular disease. What is quite perverse in the way they are then commissioned is that they are paid to treat up to a certain proportion of their register with interventions that prevent that register from those people with those diseases from deteriorating further. And that threshold, depending on the intervention, is somewhere usually between about 85 and 97%. So there's a 15 to 3% cohort of residents that are never, ever treated because GPs don't have the resources and the funding to do it. And you can bet your bottom dollar that those are going to be the hardest to reach patients. So we are commissioning through the QOF contract, and I've been whinging about this for the last decade, I can tell you to anyone who listen, for health inequalities. Where we put in a local contract to target those remaining residents, we can address that inequality. And that's what we will do. So we want to go over and above the QOF threshold to get to the 100%. And the monitoring is very, very easily because it is recorded on the GP system on System 1, so we can just run a report and we can see at GP practice level exactly where their performance is. We can also look at how deprived the entire GP population is through the practice deprivation score. So again, we can monitor in that way. So I'm an optimist, but I am actually highly confident in terms of this initiative that we can get to the right people. Where I did this in a former life, I took the borough's cardiovascular disease outcomes to some of the worst in the country to the best. In fact, the National Cardiovascular Disease Lead at the Department of Health rang me up and said, what on earth are you doing in your area that you have achieved results way above any other practice or any other sub-ICB area? And it's simply by doing this in a systematic way and making sure that resource is available to those practices to treat those people. And it actually isn't that much resource because it's 3 to 15%, but you can get huge outcomes. If someone has atrial fibrillation and isn't anticoagulated, which is one of the clinical interventions, a very high proportion of those, 1 in 2, 1 in 3, will have a stroke in the next 3 years. And yet, how much is it to anticoagulate someone with some drugs? Not very much at all. So you get a great return on your investment as well. But more importantly, you're preventing really serious health outcomes in the population. In terms of the INTs and level playing fields, Nick, do you want to take that one?
Yeah, thank you. I think that's a really helpful and interesting question. So firstly, I guess in terms of making sure there's that access and equity across areas, so all areas will firstly need to have a neighbourhood team, so it won't just be in some areas and not others. And there certainly is, I guess, a consensus within our wider integrated care system that neighbourhood team has at the centre of it that local area coordinator role or one of a similar name. And then a team of kind of core roles you would expect to see in that neighbourhood team. So alongside social care, obviously community health, GP, key VCSE partners that work in that area, and then a wider set of support offers that are pulled in as required. So it could be drug and alcohol services, perhaps as commissioned by Public Health and others. And I think that vision is one that actually is shared by all partners, not just adult social services. We had our integrated care system conference last week where we were talking about that, and everyone I think is on the same page. So that, I guess, is the infrastructure, but it isn't just about the teams and the infrastructure around it. Essentially, if you get a neighbourhood team right, it will look different in every area, and it won't be the same, as it will respond to local needs of local residents. So it might be that in some areas your neighbourhood team decides actually there's a particular focus that, as staff, we see amongst our residents live in our area, so we'll focus on that. Often those local area coordinator roles that I've mentioned actually are people who live in the local area, and they come so they understand community needs. So there isn't one way in which to make sure that access and equity is there. It has to come through all of those different avenues. And I think we'll know that, I think, if we're sitting here in 2 years' time and our residents and our staff feel that there is that equal access in every part of the county has access to it in that kind of way, then we'll have done it right, I think.
Thank you. I'm just going to ask a question myself, but I'm also, I still have a list of speakers, so I'm going to ask a question, if I may, and then I've got Stuart Clancy, then Chrissy Rumsby, and then I've got Serene Shibby Sexton. So I haven't forgotten you. It's just that we're having, I've seen some more people ask. And so then that will be Mr. Chenery, and then that will be Sharon Blundell. So my question or observation is, all members have local highways officers, and they make themselves known to us, and they communicate with us, and they tell us where they're based and stuff, which is very helpful for us dealing with highways issues. So can members be advised of who their local area coordinators are, please? And can they make themselves known to our members so that we have an easier pathway, maybe? Because obviously Leslie is talking about this online form and the onerousness and the criteria. So is there a simplified way that maybe under local member protocol we can have some kind of conduit into somebody who's named and a figurehead to contact, please?
Yes, absolutely. When we have them in the level that we want them, then we'll make sure that that's certainly the case. And what I'd also say is that we do currently have roles called development workers as well, who do some really fantastic work in local communities around local assets and development. And there's also officers that we can actually right now make their contact details known to members, but they do have some really strong relationships at a local community level that they can build.
I think that would be useful, because I sometimes end up scrolling through the phone book looking for, typing in a word to try and find an officer or somebody to ring up about predominantly issues with my residents who are elderly and frail. And it would be much easier for me and make my life much easier if I had somebody to go to. Even if they weren't the right person, they could point me in the right direction. The only way I tend to do that at the moment is to directly email Ian and say, can you just send this email to somebody else? And I think we could be a bit more slick with our process there. So that would be really great.
I'd expect that actually to be a two-way relationship as well, because as divisional members, you have a really great understanding of your community and all of the assets within it. So as part of their inductions, that they ought to be hammering on your door and wanting to pick your brains as well and get your views as to,
I think
to
if they're
what the issues are.
If they're going to be covering a cluster of different divisions, I think it might be helpful if we could kind of like arrange and have a meeting with them all and that sort of thing.
Absolutely.
To do that.
Absolutely.
So I think that would be really good. And that would certainly improve my, my time management, in that I had someone to actually go straight to. Even as I said, they weren't the right person, but they could signpost me in the right direction. So I'll move on then, Stuart. Thank you.
Thanks, Sheila. I think this report, in essence, follows on from the other report, because I think the finance is very much linked to the service provision. I'm pleased that we are taking what I would call a proactive management and leadership approach to it, that we're starting from the basis of all resources are scarce, because all resources are scarce. There has been this perception for a long period of time that basically we just sling more money at it and we solve it. That's not the case. We can't do that. But the reality of it is, I think what we're looking at here is a people-focused approach, a much more integrated approach, learning from best practice elsewhere, not just in this authority, but in other authorities, and to make it actually work out there in the ground. We've got the right, hopefully we're moving to the right people, doing the right jobs in the right places. And I think these are really important things. Other members, Councillor Sands, Councillor Watkins, have alluded to where it needs to be happening at the ground, at the base level. And it's not one size fits all. Again, I've heard this mentioned. It's great that we're recognising not one size fits all, because basically sometimes a little help will go a long way. It's not just about, oh, by the way, we're, you know, again, I can speak personal experience. Sheila's mentioned it. I've got a 97-year-old mum who, yes, is very time consuming, a bit of support from various areas, and she still lives at home. It's been difficult, but some of the experience, what I've learned personally on how to, in inverted commas, manage this situation, hopefully we'll help more and more people. And again, we one or two of us has been around a long time. Independence Matters started a long time ago, but this takes it to the next step. Integrated teams, I would like the maxim of the old-fashioned KISS, keep it simple, stupid, cut out the bureaucracy, cut out the red tape, be single-minded, people focused, because we'll get far more better value for money. We'll get it down into the libraries, we'll get it down into the communities if we keep it simple. And we actually cut the bureaucracy and the non-productive element of the service. The productive element is to deliver at the maximum for the minimum, as I would see that. And that's me speaking, not as a social worker, but as a manager. And I think this is where, genuinely, I really do think this initiative can and will work. It will work most importantly for the end user, the clients, customers at the end of the service. But it's, as again Nick's alluded to, Ian's alluded to, it's not going to be without the bumps in the road. Of course it will have the bumps in the road. Some of the basics we also need to get right. It shouldn't take 58 minutes to answer the telephone. We need to address some of these very, very basic systems. Getting people to call you back when they should call you back. Again, these are my personal experiences. If they tell you you're going to call back, let's do it. Let's make sure. And with the initiative, it's all about the team, making sure the initiative, what the senior management are coming through, get everybody enthused about the team. This comes down to the leadership of the team and how the team is led, so that everybody understands and wants to be part of that success. And I think people will if they're well managed and led. People won't if they're not well managed and led. And I think, you know, this is a great initiative, and I think we spent a lot of money on consultants, but I'm really pleased that the management team and the leadership team in the authority are actually taking it on now.
Yeah, just
Respond, thank you.
not for the first time I find myself in wild agreement with Councillor Clancy, so thank you for your kind words first of all. I entirely agree on your point on bureaucracy. I didn't mention it in my introduction, but one of my other observations, and it's perhaps the comment that is made most frequently to me when I go out and shadow frontline teams, and I really believe in doing that, is that people are spending far too much time transacting the bureaucracy rather than having face-to-face conversations with residents. In terms of people not calling back, again, that speaks to me about an anonymous box-ticking bureaucratic machine, doesn't it? Rather than a named individual who's accountable that you deal with and then brokers that support in around you. But you have your one contact and you have that person's phone number. And that's how that hyper-local integrated approach should take. But entirely agree. And it always comes down to leadership. That's what makes a difference. We are using a few expert consultancies to help us with little bits of the programme, but I've shied away from bringing in a big management consultancy. I've seen that model before, but often they come in and then they leave and then it all falls apart again. And I don't believe in that. I think we should be devising and leading this ourselves.
Again, I don't wish to be seen to be doing a double act with you, Mr. Wake, but I am impressed with that as well, because I think every councillor in this room would agree that we need the resources actually at the front line, not in consultancy. And we need a well-motivated, well-managed team. And I genuinely believe we're certainly moving in that direction.
Thank you. I have Chrissy Rumsby next. Thank you. Please.
All I can say is hallelujah. At last we're getting personal-centred care without the tick box of personal-centred care, which has been a total nightmare for myself as a ex-mental health nurse. I recently went to Swallowtail in Acle. And I don't know if any other council's been there or been to a like-minded home. But honestly, I can see where the social isolation, because like you're saying about social isolation, that is the cause of so many mental health issues and physical health issues. And I could see where that really works well, because thank goodness it's not like a care home. You've got your flat. If you want company, you can have it. If you need a bit of help, you can have it. And if you don't feel like particularly, cooking something, you can go down to the cafe, get some nice scones or whatever. And actually there's people in the community is there, so you can have a good conversation with people in the community. And you haven't got far to go to the GPs or anything else like that, because it's literally very short walking distance. And I can see where the future is in homes like that, which will actually stop people from getting a lot of really bad socialisation and all the issues that come from that. And also there's people there that can spot something before you might even spot it in yourself. So, yeah, I mean, kudos to that. Like Councillor Smith-Clare, I have concerns about the third sector, because, I've chaired a charity in the past and things like that, and I have a lot to do with it still. And, I do have concerns about some of them are really struggling at the moment. That could be very helpful. I do have some questions. I wonder if you could answer about Project Victory, where that is with the care homes. Also, how can we work more intergenerational as well? Because I know somebody sort of runs a charity that actually develops people working more intergenerational. They go to care homes and things like that with children, and it really helps people with dementia particularly. Also, I haven't written down, I don't know what's happened to me today. I was wondering how we're getting on with carer vacancies, and also value for money. Often we hear about value for money. Now, has that changed? I don't know how it was defined before. It always confused me somewhat. But has the value, the formula that is used for value for money, which has always been like something I've never totally understood, has that definitions changed now with the way you are changing care? Because often, people like Councillor Jameson, for example, say value for money. I think, how do you define that? And has that changed now? We are actually changing course at last in the way we actually shape care. And also to say that we had community connectors in Malcross. Fantastic job. We lost them, and don't we miss them? Because, like the saying about the 95-year-old lady, they worked in the community, they lived in the community, they'd know about that 95-year-old lady, they'd either would get a taxi to get them to the community cafe, or would take some food to them if they needed it, do you know what I mean? So community connectors, I can see how they work really good with actually spotting what the needs are and connecting with the people who can actually help with that need. Now we've lost them, I can see the loss, do you know what I mean?
Okay, I might call on Nick on some of those questions. I'll maybe take them in reverse order. The value for money one's really interesting, isn't it? Because there's been all sorts of metrics on VFM that I think have been quite dubious in the past, and I would largely agree with you. The one I really like in terms of VFM is to look at the resource consumption, the public sector resource consumption, pre and post working with a resident with complexity in a relational and integrated way. And what you find, the stat that sticks in my mind, and it was from a project I'd set up that looked at those people with overlapping care needs, mental health needs, housing needs and addiction needs. And we employed an assistant psychologist to look back at the 18 months that this cohort of residents, and they had antisocial behaviour issues, a lot of them, they were quite chaotic, really quite complex. And we looked at all of the times they had accessed a statutory service and how much that had cost. And we found, we only managed to do it for 5 because it got so complicated, because they were consuming so much public sector services. But for those 5 residents, we found that they'd consumed in 18 months £1.2 million worth of public service. And then we looked at the 18 months when we started working them in this relational way and in this integrated way. They consumed £62,000. So there was over £1 million saving on 5 residents. Now, there will be tens, if not hundreds of thousands of residents in Norfolk that have some level of complexity. So that's a really powerful metric, I think, in terms of value for money. Carer vacancies, are you talking... could you just expand what you mean by that?
It's just that at one stage we're having problems actually employing people for the care homes and, the sort of like, you know, or home care. Because obviously when we had Brexit, a lot of people left.
Okay.
And I didn't know whether we've managed to fill the post, because if we haven't filled the post, we can't do the care, can we?
Sorry, I misunderstood. I thought you were talking about informal carers, but can I hand over to Helen on that one?
Of course, thank you. So we have seen improvements across the country and specifically in Norfolk around vacancy rates for adult social care in the independent sector. We're currently at 7%, which represents 1,000. It was 8.5%. So we've seen a continual decline since about 2021. I would note it has been significantly impacted by international workforce. That workforce has really enabled us to fill our vacancies, but also provide a stability, so to reduce turnover. And with the recent changes in legislation, we'll be presented with a new challenge on that. So there's continuous work and development to support providers and the sector to recruit and retain.
In terms of intergenerational approaches, again, I couldn't agree more. I think that's really powerful. I've seen that work so well in so many residential care settings. I'm aware that many of our providers already take that approach. There's possibly an opportunity to do more, but that's always something that we will promote. Again, do you want to come in? You're more qualified than I am on the detail of this.
Sorry. Yeah, so we are seeing small projects, things like Friend Indeed, going out to different care homes. We're trying to get those best practice cases out through our information and brokerage service to inform registered managers and just get that peer-to-peer support about where this works and how it can work. And again, we'll be continuously feeding that into our leadership programs, because it's not only the benefit for that workforce individual, we can also help educate people about what it is like being in a care home setting, because we could promote it for a future career for those individuals as well.
And then can you take the Project Victory one? Are you aware of that? No.
Apologies, I'm having a bit of a brain fade about Project Victory. Could you just maybe elaborate on what Project Victory means to you, and we'll see if we can pick that up. Thank you.
I just heard it, and I just wanted to know if anyone actually knew much more about it. I couldn't have a...
I'm afraid I don't. We will investigate it, and can I write to you maybe with an answer?
Yeah, that would be fine, yeah.
Yeah, okay. Sorry about that.
I've not heard of it myself.
Chairman, can I just say that the Project Victory thing is something that was at one of yesterday's meetings, and it's Norse who are involved with that. So I don't know if there's any connection.
We'll write to you with an answer. Thank you.
Right, we'll get a written response. Perhaps that can go to everybody, because there seems to be a bit of a...
Of course, Chairman.
...vagueness about the situation. Right, Councillor Shireen Shibley-Sexton next. Thank you. Thank you for your patience. I have, after that, Michael Chenery and then Sharon Blundell, and then if anybody else wants to speak, Yes, I'll put you down then. And then I will call after the 9th one. That will be the end of it. Okay.
Thank you so much, and it's been really good to hear, echoing what everyone else said, it's been really good to see that move to preventativeness and integrated holistic outlooks, especially because mental health impacts your physical health impacts your mental, and your community, and your ability to engage with community is deeply based on your mental health, with your material conditions underlying all of this and being the foundation of it. So it's really good to hear this very holistic thing. And a lot of my question has now been asked by both Councillor Rumsey and Councillor Bambridge, because I was interested in understanding more about the local area coordinators and how they operate within especially more urban areas where communities are based less around neighbourhoods and more, if they're more densely populated, they're just based more about social relations and less about your geographical location. We don't have village halls or parishes. Sometimes we have community groups, but they are more limited. And we have a lot of issues around isolation, especially not just in the elderly, but within young people. We have areas like Thorpe Hamlet, which has the highest amount of young people living alone, just single occupancy housing. These people are often not connected to other networks, other social care networks, but are experiencing that same loneliness and mental health issues that is pervasive throughout all age groups and demographics. So I'd really love to know how they will be reached out and how local area coordinators can indeed reach more communities, especially the ones that maybe don't see local government schemes as being for them and feel very alienated by the system. Thank you.
Thank you for your question. Again, another great question. They are entirely community-based. I think it's actually probably easier for them to work in an urban area than a rural area just because of the concentration of population. They work on a series of principles and values. So the first three fundamental principles and values are don't break the law, don't break the bank, do no harm. And those are unbreakable. And then the remaining ones are form a relationship, no assessments, you're not about assessing people, no referrals on, you hold the case, you form a relationship, you understand what's important, what matters to you, what does a good life look like for you, conversation, walk alongside the person for as long as it takes to help them meet their goals as they've defined them. So you don't just get 6 sessions and you're discharged, and have a really, really good understanding of all of the groups and assets within the community, connect people with those groups, and spend 20% of your time actually working with the community to help them develop more groups and services, so that asset-based community development approach. And then finally, minimal bureaucracy. So, yeah, I say no assessments, but capture the learning. That's what's really important. Capture the learning and feed the themes that you are picking up from the community, from frontline, back up to commissioners, so we can start to unblock the blockers and transform the system. And when you free them to work in that way, and yeah, maximum face-to-face time with the residents, as I say, I've seen this in action. It's really, really powerful. And actually members love them because they're often picking up your complex casework that the system's failing them, and they are the glue that knits the rest of the system together, and they bring services around the individual again rather than referring them on. Does that make sense?
Yes, I was also wondering, I think the other part of that was that communities aren't a monolith, especially not when it's very urban. So how do they make sure they're engaging with all communities within an area where it is just a lot more dense and it's not about neighbourhoods as much?
I think through a variety of different mechanisms. There's an element of word of mouth. If you're a really good community worker, then you get up and you speak to as many people as possible. So it's about identifying where residents congregate. It's about having community surgeries. It's about working through perhaps some of the faith organisations. It's about working through the existing community infrastructure. It's about having your surgery in a supermarket or in a library. So it's about the individual going to where people are rather than expecting people to come to us. And it can be done in a proactive way, as I've said. So you can look for a signal. And in some sense, it doesn't matter what the signal is, as long as the signal identifies complexity. So actually, debt is quite a look and be proactive, knock on the doors of the people with the greatest amount of council tax debt and say, because that's usually a signal for something else going wrong in the life of that family, and say, we're just here to help. Is there anything we can do? And try and start to form a relationship and let the solutions and the goals drop out of that relationship.
Thank you so much. That's very helpful.
Right, thank you. I have Michael Chenery next. Thank you. I'm working my way through. And then after that, two more. And we'll wind that up, I think.
Thank you, Chairman. On page 58, on 1.2, building on good practice. My eyes have just gone blurred. In good practice integration in learning disability and mental health. Now, strangely enough, I've heard about this since 1990s when I was in the Mental Health Trust. What are you intending to do? What about further integration can you do? And are you working well with the NSFT, which I'm a county governor of?
NSFT's had a troubled history, as I think we can all recognise. It's got a new leadership team, a new chief exec, as I'm sure you're aware, and a new executive leadership team. I've been really impressed with them, I have to say. So I had an excellent meeting with Gary O'Hare, the chief operating officer, about a month ago. We were actually supposed to have a joint DLT operating leadership team meeting this Tuesday, but suddenly he's not very well, and so it's been postponed to the new year. But I think there is a huge opportunity. The mental health system in Norfolk is fragmented at the moment. It's too biomedical, and there are too many handoffs. So it's kind of the antithesis of what I've set out here in terms of the principles and values. I was so impressed with Gary, and actually ELT had a joint leadership team with their executive and Caroline Donovan. They're on the same page with this. So we've built, I think, some strong relationships. What we need to do now, one of my observations is that the health and care and third sector system partners in Norfolk there's a lot of very goodwill in the room, and there's a lot of positive relationships. We haven't historically sat down and done some really effective strategic planning in terms of how we're going to codify, how we're going to work together in an integrated and effective way in the best interests of our residents. And we need to do that quite urgently, I think, for mental health. So develop that whole system strategy that sets out and embed some of the things that I'm talking about. But I am really encouraged by the direction of travel of the new leadership in NSFT.
Do you go up to floor 7? Kath Byford is up there now, and again, she's a deputy. She's very open. But we used to work in the 90s in West Norfolk. We worked very well with social services. They were all part of a team, but I don't know what happens now.
Yeah, I think it is quite fragmented. Our teams are based within the trust, so we do have those relationships. But I think the broader system needs some reform. But we're at the start of that journey. But as I say, I'm very, very encouraged. The value set of the new leadership team, I think, is spot on, and they really want to work with us. Yeah.
Thank you, Sharon Blundell. Thank you, please.
Thank you, Chair. I've just got to read my notes now, make sure I can understand what I wrote even. Okay, first one, I totally agree with Councillor Clancy. Communication has always been an issue with me. I know everyone's busy, but residents need to know where they are. Yeah. Second point, face-to-face, absolutely brilliant, because you can write on a form, I have pain, but it doesn't actually they don't describe how much pain. They could downplay it or obviously go the other direction where they're saying something totally different, where they don't need help. What else is there? Can you just reassure, there's two questions. Can you reassure me that this is not going to require more people coming forward to become unpaid carers? Because I couldn't quite, yeah. And second, on page 70, the third box down, because I cannot say the first word in that box and I'm going to pronounce it wrong, is about care packages. Now, I'm assuming everyone with a care package at the moment will keep that care package and it won't change, or is it going to change slightly, if you see where I'm coming from? Those people get
17
care packages now. They're not going to, they're going to stay there until, or are they going to, and that's my questions, thank you.
In terms of your first point, there is no expectation of a greater reliance on unpaid carers. As has already been articulated, I think, very beautifully in this meeting, I think the unpaid care sector is worth about £2.4 billion to the UK economy. We destroy that at our peril, quite frankly. It's something that's very important to me. I meet with Sharon Brooks from Carers Voice on a bi-monthly basis. We've got a really strong relationship with Carers Matters, but the model isn't predicated on creating more unpaid carers. In terms of care packages changing, I mean, the Care Act puts a duty on us to review care packages at a regular basis. So I can't sit here and say that no care package will ever change in the future. And actually, I don't think that would be a very good outcome or a very good aspiration for us to move towards. It very much depends on individual circumstances. But actually, for not all, but for some of our residents and our cohort of residents that we support, I believe that we need to be far more ambitious in enabling and re-abling them so they can increase their independence. So actually, a good metric on value for money might be that for certain cohorts of residents, we put in intensive support to start with, say if someone's in mental health crisis, but as we work with them to help them to improve, then that care starts to drop off because they no longer need it. And so we are helping them to maintain independence. So I think it very, I mean, for others, if you've got someone who's very frail and elderly, they are just, because of their age, likely to deteriorate, and you wouldn't expect that care package to necessarily be withdrawn. But for particularly on working age adults, I think for some, not all, but for some of our learning disabled residents, again, we could be a bit more ambitious in helping them where they want to access employment opportunities. That might mean that the daycare package might change. So I think there are some really positive opportunities in changing care packages as well.
Can I just come back, Chair, over here? Yeah. I was just saying, because obviously reading it, if I was a resident reading that, I'd be worried. So you've explained the situation. So if anyone is watching, I just wanted it to be, I understand. Okay, thank you.
But perhaps it's a really good point. Perhaps we'll have a look at the text on that and maybe refine it so we're not causing people undue concern or distress.
I just also want to quickly add about carers. I mean, completely echo Ian's point about it not placing additional burden. One thing that is really important, though, is that we know there are around 95,000 people providing unpaid family care in Norfolk. There's a lot of work that's been going on to try and identify carers more readily, so people who often don't know they're a carer come forward and we can provide them with support and advice. That still remains incredibly important, and we want to support as many carers as we possibly can. So the identification and supporting carers is as or more important than before, but absolutely this is not about placing then additional burden on them.
Thank you. Okay. Mike Smith, Claire, thank you.
Thank you, Chair. I will keep this succinct, but I cannot hold back my excitement when it comes to these community connector roles. You know, not a lot gets me excited on a wet Thursday, but this has. What I think would be hugely useful, bearing in mind that this offers the pivotal part of the transformation process as individuals, could us as members have almost a flow chart, an idea of what this role represents, something very succinct, because as Sheila's pointed out, they are going to be coming to us, we are going to be going to them. It becomes a no-brainer in terms of what the support and also the benefits can be. The second point is, how many do we envisage? And I'm thinking particularly about, Great Yarmouth. In the past, when it was Neighbourhoods at Work, there must have been about 6 community connectors. Are we looking at one connector having a huge area or a range of connectors? So that type of description within this flowchart would be really useful. The other point within this flowchart would be, I envisage community connectors being employed, put in place. They'll need time to build their knowledge of the community. We know no two communities are the same, so there's going to be differing amounts of support and need that's going to be placed on their shoulders. Once they've built up that knowledge, of course, they're going to know what's there and what isn't there. How then does their role fit into that commissioning process? Because not only are they going to be supporting local residents to form groups, so they're going to have a lot of knowledge in helping them with that grant system, their micro grants, but also their research, their knowledge is then going to shape what money comes down in terms of a commissioning process. Now, I've got that knowledge, I can see this. I think for so many others, that timescale strategic process would be really usefully visually presented. Thank you.
Thank you. I really share your excitement, so thank you for that. My colleague to my left is itching to answer this one, so I'm going to hand to him.
Thank you. So, in terms of, I guess, what will they do? Absolutely, we can share a kind of broad outline about some of the key parts of the role. What we can also do is show you some examples about where within the county there are roles that are a bit like this already or have been. So I think there is something really powerful about seeing that. As I know a number of colleagues have mentioned, we've had roles like this before. Marlcross is a good example. So we'll absolutely do that. How many? I guess where this has been delivered elsewhere, generally it's on around 1 per 11,000 population basis, but that will vary depending on, as it's been described by others, how much travel time is required between areas. But when you scale that up, we think it's somewhere around 85 that are needed across Norfolk as a whole. But as I say, that will vary then when we actually break down into the detail. So it's a fair number. And some of that will have to be about how we change probably the existing way that we work with some roles that we have, but also in not just being seen as this is about adult social services, for example, being the employer of those. There are some really interesting opportunities for us to test, as I think a colleague mentioned earlier, some of those roles perhaps being hosted by voluntary community and social enterprise organisations as well. That's how some other areas have done it. And that last point about how do you build that learning cycle between those on the ground and then commissioners, would completely echo. One thing we have done, which builds off colleague Chris's point earlier around asset-based community development, is that some of our actual teams that do that ABCD work within social care now sit in a team alongside our commissioners, so that actually they can just build a relationship with each other. And over time, we will build that more formally into how they take that learning directly from them, and then it informs our commissioning approach. So I think you're completely right about the importance of that.
I think there are opportunities here to work with town and parish councils, perhaps some of the larger ones who've got the facilities and the meeting and hire facilities. In Helsden, we have a council chamber that is used by council meetings, but we are expanding that to host other activities. For instance, the Airport Consultative Committee now meet there. And I think there's an opportunity here for these local community people to have local surgeries and things, even if they have a couple a year, and they can be advertised more locally when they're attending, so that there's a better communication. And we also host the Children's Family Hub in another building that we have. So I think there's lots of, predominantly not the small parishes so much, where you'd have to maybe point people to a larger parish nearby if you did them in clusters. but certainly the larger town and parish councils do have the facilities to host these sort of surgery opportunities, and I think that's something that maybe we should think about piloting as we move forward to work on and see if they work as well within your community coordination programme. So I've come to the end of my list now. We've had 9 speakers here, and I think we've spent quite a lot of time on this. So with your abeyance, please, I'd like to look at the recommendations that we have, which are on page 57 of your agenda. There are 3 recommendations there that I'd like you to consider. I think we have explored them well, and we're very enthusiastic about the programme that's now coming forward, and certainly support it wholeheartedly. So can I ask councillors if we can agree those 3 recommendations, please, on page 57? Agreed? Yeah. Stuart, do you want to just add a bit? Stuart wants to add a bit.
Thank you, Chair. I think, again, several members have mentioned to that. I think there's a good deal of enthusiasm, as the Chairman said, for the initiative, and I think there's a good deal of consensus on it. But I also think it's very important that we have reporting back. So if we could add a 4th recommendation, that there is reporting back to this committee at I don't know, I'll take guidance, 6 monthly intervals or something?
Yeah, that would be fine.
At 6 monthly intervals, where we get a detailed report, where we're not always talking about after the event. We can preempt potentially any problems. We can speak to the directors, and we can make this actually really work. So hopefully we'll add that as a 4th recommendation.
Yes, thank you. I've just added there, we'll report back a 6 monthly overview as an additional item. Can we agree that as well, please, councillors? Lovely. Thank you very much. So we'll move on. And does anybody want a break for 5 minutes? No, we're going to move on from the looks of things. We will move on then to item 9, the fair pay agreement in adult social services. There's a public consultation here. We have to respond, I think, by a date in January. So this is the there's not a presentation on this. It's for our information, and the officers are here to answer any questions. So are there any questions, please? Nick, did you want to say anything about this? Because obviously it does say here you're not going to present on it, but you might want to say 1 or 2 pieces.
Okay.
Please.
Yeah, if maybe between myself and Helen, we'll just quickly summarise. So we know the UK government has launched a consultation on the Fair Pay Agreement, and that's part of their broader Make Work Pay plan. It's, I guess, described in the paper. Social care is a large sector. We've got around 28,000 workers in Norfolk as a whole. When you look across the whole sector, supporting somewhere in the region of around 40,000 people in the county. I think it's been mentioned earlier, actually, that our workforce are both the backbone and actually also, I think, the heart of our whole social care operation. People who work tirelessly every day with that compassion, skill, and dedication. And so we know the stability of the workforce in Norfolk is incredibly important. Helen has already mentioned earlier that you look at our vacancy rates and our turnover, and it is improving. But we also know that this is a sector that is growing significantly in Norfolk and across the UK. So essentially the Fair Pay Agreement is about that pay, recognition and reward for the workforce as a whole. Is a really important topic, but I guess important to mention that it isn't only one element of that wider sector reform that actually we picked up in conversations earlier, such as the independent commission that Baroness Louise Casey is leading. So I'll just pass over to Helen just to give a quick overview of the detail of the consultation process.
Thanks, Nick. So as Nick has just outlined, it's part of the Employment Rights Bill, which provides the legislative framework for fair pay agreements. And adult social care has quite rightly been identified as the first priority sector. The aim really is to set legally enforceable minimum standards for pay and conditions, but what that means is still an unknown. It could include not only base pay, but sick pay, travel time, annual leave, training, a whole raft of measures. This would be implemented through sector-wide collective bargaining, via a newly established social care negotiating body. So I thought it'd be helpful just to position what we know and what we don't know. We know that the government has committed 500 million as an initial investment, and it's part of a 4 billion uplift, and that the consultation closes on the 16th of January. Implementation is expected in 2028, so this is quite a long-term piece of work, and the exact timetable is still going to be dependent on legislative process and negotiations. But there is a considerable amount that we don't know: which roles will be covered, which employers will be covered, what those pay rates, terms and conditions will be considered. So that will be in the gift of the negotiating body. We don't know how much the funding mechanism will work and how those costs, quite importantly, will be covered locally. These unknowns have significant implications for local authority commission contracts with our care provider market, and those projections will remain uncertain until after the consultation and further details published. We will be putting forward a formal response, and we would very much invite and value your input to that.
Thank you. Many years ago, long while ago, I did a bit of care working, and I found that I didn't get paid for my travel time at all, and I often had to travel distances, and then it was in the city, so you were trying to find car parking and difficulties, and I think it's proper and right that people do get paid for their travel time in between client calls, particularly care workers that are doing a round of, say, 7 or 8 visits. I used to do evening shifts because my children were little, and it was often very difficult, but I didn't get paid, and I found that probably by the end of the week I'd probably work 4 hours of time that I didn't get any recompense from at all. So I think it's very important that those conditions. I also think the other condition is that all staff who are doing particularly care work are provided with a paid mobile phone as well. And I think most of ours are now. I think everybody is, and that was something I was very keen to establish when I first became a councillor. When I started in 2001 doing social care right from the start, was that everyone had something, because I was at the time working and I had to provide my own phone, and if I used it I had to then try and claim back the call amount, which was sometimes very difficult. So they're my 2 contributions to it. I also think the other thing is other terms and conditions, not necessarily pay, are very important for care workers, including getting the right mileage recompense for their vehicles, and also protection, and also the correct amount of appropriate uniform. But they aren't part of, I don't think, this particular, although they are add-ons, because I know some care workers don't get provided with much uniform, and then if they want subsequent tops or trousers that match, they have to buy them themselves, and I think that's really wrong. I think uniform should be provided properly, so that if you get a soiled uniform, you've got a spare one or a couple of spare ones. So they would be my views if they sort of correspond with the kind of consultation you're having. I know that Stuart wants to say something as well. Thank you.
Yeah, thank you, Chairman. I think care work should, under no circumstances, be undervalued. I mean, it's extremely valuable what carers, and a good carer is worth, in my honest opinion, again, and I'm seeing it personally, so I do know a bit about this. A good carer is worth more than what they're currently being paid, without a shadow of doubt. So again, I concur with everything Sheila's said, but I do think, again, it's absolutely crucial we get this right, and I fear, yet again, we're looking at an element of it without looking at a holistic approach about adult social care. Every government consecutively has ducked looking at the big picture and addressing the big picture and dealing with this in a way which is equitable and fair to everybody. I think it's worthy of mentioning that it's not simply about what you pay carers, it's about how care is funded, who pays for care, and, you know, should be a greater emphasis on independence of care. It's not, in my honest opinion, about putting older people, oh yeah, pop them straight in a care home. That isn't what it's about. We need to be looking at what I would describe more as the European model. I mean, we all see it in Italy, France, Spain, where family members have a role in this, if there is family members available. Of course, if there isn't, it's absolutely incumbent and right that the state should take this on. But I would totally agree that we do need to ensure carers package is a good one, and it incentivises people to actually come into the care industry and as a worthwhile career, and to pay those people who are actually doing the job, because there is a risk in every aspect of this work that somebody who, inverted commas, is a very good carer, they suddenly, quite rightly so, want to progress their career and want to become a team leader, a supervisor, manager, registered manager, carer, whatever. And that means that, unfortunately, the reality of the incentive and the, how can I say, the aspects of the career progression as being an actual person who does the job is not well incentivised. But I think to look at this in isolation, again, as I say, I'm not looking at political points because the previous government ducked it and ducked it and ducked it. This government is ducking it and ducking it and ducking it, rather than addressing the whole issue. And I think it has to be addressed.
Does anybody else wish to say anything? Sharon, thank you.
While I agree with everything Councillor Gurney and Councillor said, I read in here somewhere, I can't find it now, about children's services, and if their pay's not done, they might jump over to adult social care. Why can't they do it side by side? Because there's two different sections, is there not, in government, who will deal with or whatever they're doing? Why can't they do it side by side so they're mirrored? So otherwise you're going to have an issue in children's services where there's going to be no staff in children's services. While I appreciate carers do a brilliant job and they deserve money, yeah, that's where I'm confused. So I'm sort of, and there's not much information.
Yes, thank you. We'll make sure that all of those points are reflected in the consultation back to government, all really valid and pertinent points. Thank you.
Thank you. So there really are just our comments, really. I think it's a difficult one for us to comment on. I think it's more of a perhaps an organisational HR kind of thing myself, but thank you for bringing the paper to us and our attention. So I'm going to move on now to our final item before I sit here and freeze, because it is getting rather cold in here, I'm afraid. This is one of our economies of scale or cutbacks on heating. Sorry, whoever needs to note that one. I think next time we either need a smaller room where it could be a bit warmer for us in January. Or an overcoat allowance, I'm being told. Next time I come, I have been known to bring blankets into here and cover my legs with cover my fleecy blankets, so I might have to bring one next time. Anyway, we'll move on then to item number 10, which is on page 94, and that's our forward work programme. So, Becky, do you want to report on that, please, for me? Thank you.
Thank you, Chair. So before you have the forward work programme as set out and previously discussed and agreed by the committee. There's two parts to the paper, which is the forward work programme itself, and there's also an additional item which is to consider the policies which fall under this committee's remit and to consider the approach to reviewing those policies. For ease of reference, you've been presented with all of the policies within the strategic framework, but the keen eyes among you will notice that only one of those actually falls within this select committee's remit, which is promoting independence, the adult social care strategy. So there's two elements for committee to consider. If I just highlight some specific items on the forward work programme, obviously, the recommendation that the committee have agreed on item 8 which is to essentially allow the adult social care officers to work to bring items to this committee to do deep dives on the adult social care transformation. That will now be incorporated into the forward work programme, and I'll work with adult social care colleagues so that we can devise that timetable and bring that to the January meeting of this committee. It does mean that obviously we will have a view to the items that members have raised and want to consider, and that balance between doing both within the committee's time. For January, it was proposed by members that they wish to see an item on vital signs and performance indicators. Just to update committee that we've been working with our colleagues, and we believe that we will be in a position to incorporate vital signs and performance indicators into your future reports. So what I would suggest for committee to consider is, rather than a standalone report on reporting, that the committee potentially consider a future path, which is we bring that information to you in the reports, and separate work and information is provided to show you those dashboards on reporting separately as an information piece. So there are a couple of things I just wanted to flag up. Also, in addition, I would say that we've got there for noting or for future. It was raised at the July meeting about the cardiovascular disease pilot, and that's on there as a proposed agenda item. Obviously, given the fact that that's now part of the transformation plan, that will be brought as a deep dive as part of a paper to committee. So if committee are happy, that will be incorporated into a paper at a future time, rather than a specific standalone report. So happy to take any questions or comments on that, and obviously it's for committee to determine the forward work programme with a view to when the committee considers picking up the promoting independence strategy. Obviously Ian and Nick may have a view to that, or it could be that we take that away and bring a proposal on when that can be incorporated, potentially with the 6-month review that has been recommended in the earlier item. So that's everything from me. Thank you, Chair.
Thank you. Do we have any questions or queries on the forward work programme or anything that's been said? Nick, thank you.
Just on that last point, Becky made it will come back with a recommendation if the committee is happy about the promoting independence strategy in terms of when would be the right time to bring that to the committee. So we'll take that as an action.
The only comment I'm going to make is that I don't see anything on the policy framework from public health. Will there be anything that is added to that from public health at all?
I think my initial response to that is that the transformation that we've set out today includes public health.
Yeah.
So they're leading on key elements, so the asset-based community development and the population health management. Chris, I don't know whether you wanted to add anything else.
So we do have a public health strategic plan which was agreed previously and previous committee and cabinet, so that has been agreed. Whether it makes it onto this framework, policy framework, I'm not sure. But we do work to a public health priority plan.
I'm just asking Becky about that, and she's saying that she's going to take that subject away and have a look at where it can fit appropriately into the work programme we're doing, because obviously I want this committee to, it's called public health as well, and it needs to be looking not just all the time at adult social services, it needs to cover that as well, and I that's what I wish it to do, actually. Stuart, thank you.
On the public health one, Chair, I may be out of order when I'm saying this, and I've maybe got this wrong, but if I have, I apologise. But I would like to see a piece of work come as regards an education programme. It's coming to the forefront of public debate now. Specifically yesterday, it was making second-string headline news. The impact of ultra-processed foods on health, specifically children. There's now some, again, I don't know about this personally, but I know what I've read, what I've heard, Science is now suggesting that ultra-processed foods are impacting totally detrimentally on human health, specifically young people. Now, again, if public health could have some role in this about education of the beneficial, simply nutritional food from scratch kind of thing, I would think maybe that might be a worthwhile piece of work, because it's beginning to dawn on people that, you know, that this food industry, which is dominated by multinationals and 9 large supermarkets, is impacting badly on people's health, is keeping food prices artificially high, etc., etc. So I think we could maybe tackle this from a public health perspective. And I think in terms of education, in terms of promoting it, just a thought, Chair.
No, I think that's a good idea. There was quite a lot of press coverage about it yesterday and in the Nationals as well. So I think we could take that one away and have a look at that as well. And I know that Becky's just reminded herself that she needs to talk to you about something from yesterday, a meeting yesterday. Thank you.
Thank you, Chair. Yep, so at the Strategic and Corporate Select Committee meeting, which took place yesterday, an item was raised about a review of the current Norse Care provision and the disposal of assets. Now, that it could be dependent on what the detail of that report is, that could fall within the remit of this committee, or it could be strategic and corporate. There could be a role for both committees to review and scrutinise those ideas. So just to flag with the committee that I'll be working with colleagues and clearly supporting Councillor Gurney and Councillor Roper to have a conversation about what that looks like and whether it's appropriate to bring that here or to the other select committee, or indeed both, depending on the nature. So it's just to flag that item for the committee to be aware.
Yes, thank you. I've only just been advised of it just before the meeting, so there needs to be a bit of planning done over which committee it's relevant for. It may be for both or one or the other. We're not sure yet. We're going to look at our terms of reference and our scope for this committee compared to what is going on. And then hopefully at the next meeting we'll bring it back either on the forward work programme, or we'll have some formal response as to how it's been determined. Now, this is I don't have this on here, but did anybody else want to say anything before I close the meeting, please? Lovely. Well, thank you very much for your indulgence this morning. It's been very interesting. I think lots of constructional opportunities and ideas, and really, really good, constructive, polite debate. And I thank you all for that very much. That's been great. Thank you. So I'll close my meeting with my big gavel, sorry. Thank you.